And good evening and welcome to tonight's program, 12 Ways to Stay Safe During the Holidays. That was Riley Richards, saxophonist Riley Richards, Don't Want to Let Go. Good evening, I'm John Phillips of Golden Voice Productions, and tonight you will hear from some of our trusted messengers who will bring you 12 ways to stay safe during the holidays, as well as hear some of your favorite holiday and Christmas videos. Now, the event is sponsored by the Multicultural Health Foundations, who has been actively involved in reaching out to keep our communities safe from the coronavirus. Now, traditionally, the holidays are a time together with family and friends, but during this pandemic, the safest way to celebrate is with people in your household. Now, we know that getting together can be fun, but during this pandemic, it can increase the chances of getting or you spreading COVID-19. Now, you can find out more information about that online. Now, tonight, we want to spread some holiday cheer through music and message from our trusted messengers about how you can stay safe during the holiday season. You will hear from messengers the 12 ways to stay safe during the holidays, and we'll have more info on that during the show.
The COVID pandemic has hit America hard,
but it has devastated underserved communities of color.
Nationwide, Black individuals have seen 2.6 times greater infection rate than their white counterparts.
The news is especially frightening for African Americans
who are at greater risk for severe complications
due to underlying conditions such as heart disease, diabetes, and obesity.
It's vital that everyone in our communities
do their part.
Mask up, socially distance, wash hands,
avoid gatherings, and get tested.
Along with the San Diego Multicultural Health Foundation, we are here as your COVID-19 trusted messengers to provide you with the facts on COVID-19.
Hi, I'm Lemon Grove Mayor Racquel Vasquez, because we want everyone to stay safe this holiday season and throughout the year. We are following the CDC guidelines and urging everyone to stay home if you're feeling sick. This will help prevent the spread of COVID-19, which is mainly spread from person to person through droplets and particulates released in the air when a person infected with the virus coughs, sneezes, sings, yells, or talks. Or it can spread from personal contact if you are within 6 feet of an infected person, whether they have symptoms or not. I know that it may be tempting to go out if you're not sure if you have the virus, but the safest thing to do if you are feeling sick is to follow the recommendations to quarantine up to 14 days and monitor your symptoms. If you have a fever, cough, or other symptoms that may become severe, contact a healthcare provider. This holiday season, our wish is that everyone stays safe so that we can get through COVID-19 together. Thank you and have a happy and safe COVID-free holiday.
I'm here today to talk about the COVID vaccine, which we fortunately have on the horizon. It promises to be here in full force so that ultimately everyone will be immunized, and this will be probably the main thing to help us in this pandemic. I also want to mention the fact that there are many times families who refuse vaccines. I've not had too many of those in my practice, but many have refused the flu vaccine. I'm also here today to encourage you to go and get your flu vaccine if you've not already done it. I think the flu vaccine became available in September, And I had mine in October, and we encourage everyone to get it. There are a lot of similarities between the flu and COVID. And often when you begin to show signs of the flu, you'll have fever and cough and body aches and runny nose and so forth. And all these are the same symptoms for the COVID. So by getting the flu vaccine, if a person gets sick, it helps the physicians and to help determine whether or not you have COVID versus something else. So the earlier they get that diagnosis, of course, the better. It's very much important to have your children and your families immunized. I think with the COVID, we have enough people who are dying and enough people who are ill with severe illnesses that we hopefully, when the COVID vaccine becomes available, everyone will go out and make sure that they receive that vaccine. Happy to be with you and continue talking about some guidance as we go into our holiday season. We have Christmas and New Year's coming, and schools are out and people are off from work. And so the typical travel that we usually do, I would encourage, if you can avoid it, to try to avoid travel. You hear advertisements from airlines, how they're taking care of their planes and so forth, but you're in an enclosed area with a number of people, and the risk, I feel, is really too great. If you can avoid this travel, try to avoid it.
Many have decided not to seek medical care for a variety of reasons, including the initial stay-at-home orders, as well as fear of exposure to COVID-19 or catching COVID-19. This could potentially lead to unintentional harm to you and to your loved ones, particularly those with chronic illnesses. As we know, it is important to continue appropriate social distancing, conducting most of our activities outdoors, washing our hands frequently, at least 20 seconds each time, and of course, don't forget the importance of wearing a mask, which we also think likely will decrease other respiratory infections during this flu season. But in addition to these important things, we must take care of ourselves by visiting our doctors to get needed care, including treatment for heart disease, diabetes, hypertension, and other chronic conditions, which are much higher in African American communities.
One thing that we should do is definitely get tested often. In San Diego County, we have many free test sites. One is right in my community in District 4 at the Tubman Chavez Center, 415 Euclid Avenue. And it doesn't take long to get tested there. If you are feeling symptoms or feel that you may have been exposed and need to get tested, please do not run away from being tested. And it will help if you do come out positive to inform others that you have been around, but it's so important to be tested. And I don't always get the flu vaccine, but it's very important to get this vaccine this year because we could be facing, two huge, the flu and COVID-19 in the same amount of time or during the winter season. So very important to get vaccinated.
Hi. Christmas is a joyous time when we celebrate the birth of Christ. Usually we come together in churches and with family and friends. However, this year, as you know, the message of Christmas hasn't changed, but how we celebrate it has due to COVID-19. The safest way to celebrate Christmas this year is to celebrate only with the people in your own household to decrease the chances of getting or spreading the coronavirus. That is the recommendation of the CDC and County of San Diego, so that we can do our part to keep ourselves, our family, and our community safe. This year, let us continue to celebrate this joyful and wonderful occasion with our hearts filled with hope and sharing our love from afar. May you have a merry, blessed, and safe Christmas celebration.
So oftentimes when we talk about COVID-19, we don't really talk much about kids or teens because we're talking about more so symptoms, infection rate, mortality, morbidity. And so because we don't see the cases as high in them as we do in other age groups, they are oftentimes left out of the conversation. However, when we talk about the overall impacts of COVID, it has affected them as well. And so it's always important to think about and include our kids and teens whenever we're having any discussions about COVID-19 or this current pandemic. First thing is get outside, don't stay inside all day. Getting outside really helps with your mental and physical health overall. This is a time when you and your child or children can sit down and develop some kind of nice DIY or do-it-yourself project, whether you have younger ones, it's a small little thing, or you're going to develop a garden or build something greater if you have older children. This is a good time to really get together and do something like that. And the other thing is that even our younger kids are used to social interaction. And so, it is possible to create an online project that you can do with other friends or family. Just remember to include the fact that our kids are suffering as well and that they need some kind of activity, some kind of outlet to keep them well mentally and physically.
We need to think about skipping the social gatherings this year so that we can survive and be healthy for future year-end celebrations, future family gatherings, etc. Look at the statistics, how many people have gotten sick, how many people are dying, and how fast those numbers are growing right now following the Thanksgiving holiday and the gatherings that people engaged in, even when the pandemic is running rampant. We can't make those same mistakes, my friends. Please, we can't make that same mistake with the Christmas holidays and the other year-end holidays coming up. We have to try to avoid large gatherings, large family gatherings, etc., for the sake of our own future and the future of our family members. So that's what my message would be. Keep it small, keep it within the immediate household, and communicate by video, etc., and realize that this is an exceptional year. It's one year where we've got to do things differently. We are survivors. We've got to see ourselves as survivors, but we also have to adapt in order to survive. And it's really for this one year-end season. Next year will be a whole different thing.
So you've heard from a lot of doctors telling you how you can stay safe, but I know some of you all may have some questions. So before we close out tonight's program, we're going to toss it to Dr. Rodney Hood. How you doing tonight, doctor?
I'm doing fine. Good evening, everybody. My name is Dr. Rodney Hood. I'm president of the Multicultural Health Foundation. The goal of the foundation in the COVID-19 Community Outreach Initiative is to educate African American and Black residents of San Diego County. We want to provide this information that will help prevent the spread of the COVID virus. As I have said on many occasions, African American are at risk of more severe complications due to COVID because of underlying medical conditions such as hypertension, heart disease, diabetes, and obesity. Now, that is why it is extremely important that we follow the recommendations of medical professionals and trusted messages, many of whom you heard from tonight. There's been a lot of conversation regarding the COVID vaccine, which has arrived in San Diego per the emergency use authorization. This first phase is being administered to frontline health workers, first responders, nurses, and nursing home residents and employees. The distribution of the general population isn't here yet, but it's coming soon. There's a lot of information circulating, and we know that you have lots of questions. The Multicultural Health Foundation is assembling a team of experts that will provide trusted information from a medical and healthcare professional regarding the COVID vaccine. Know that we will keep you updated regarding the vaccine as well as we move forward. Our primary concern and focus is to heighten your awareness in order to help keep you safe and save lives. Until then, we want to ask that you continue to listen, be vigilant. Please wear your mask, wash your hands, physically distance. Don't gather in large groups through the holidays. Our presenters did a great job of providing you with 12 ways to stay safe during the holidays. Now, we hope that you've enjoyed it and that you and your family enjoy the holiday and stay safe. So now back to the hands of our MC, John Phillips.
Thank you, Dr. Hood. Dr. Hood, while you were speaking, we had a few questions to come in. And one of them was, what are the possible side effects from the vaccine?
Very good question. So first of all, let me state over the past several months, I've been deeply involved in evaluating the current vaccine from Pfizer and Moderna. I serve on 3 vaccine work groups. One is a national work group with a group of Black physicians of the National Medical Association. We have been meeting directly with Pfizer. We have been meeting with Moderna, learning about the vaccines, asking questions that other groups don't usually ask. What is the percentage of African Americans? What were the side effects, et cetera? The other group is the California Scientific Safety Group, in which I was appointed by the governor, which has been meeting, really evaluating the same thing. That group, and I voted with them, came out to strongly support the distribution of the Pfizer vaccine. We're in the process of evaluating the other vaccine. So that being said, what are the side effects? You must know any medication, any vaccine, everything has side effects. Aspirin has side effects, Tylenol has side effects. With this particular vaccine, it is relatively very, very safe from what we know. However, when you first get this vaccine, when you get a flu vaccine, you may get a little soreness. This vaccine is what we call in medicine very reactive. So when you get it, you're usually going to feel a little bit more than you would with the flu vaccine. You may feel a little pain, a little redness, little myalgias, aching. You could get a fever. Sometimes, occasionally, the fever would be high. So yes, you may get some type of reaction when you get the vaccine. Usually it lasts a day or 2 and then goes away. That is a good thing because that's letting you know that your body is doing what it's supposed to be doing. Your body recognizes the vaccine, which is not the virus. It's actually a synthetic molecule that replicates a molecule of the virus. And it lets you know that your body is reacting to that. So that's a good thing. Long term, after that, they've studied it for 2 to 3 months, and they haven't seen any real serious side effects. There have been a couple of folks in England and a couple of folks here that have some anaphylactic or an allergic reaction. Now, we've seen allergic reactions with just about every medication that has come on the scene. So nobody has died from it. So we should expect some side effects. That's what you call life.
Well, we have a couple other questions, Dr. Hood, but I believe they kind of run hand in hand. One of them is, how do we know the vaccine is safe? And the other one is, how are we going to handle people that are afraid to take it?
So how do we know it's safe? Well, we know it's safe through science and data. So the process, especially in the United States, is quite vigorous. As the drug company does their studies, it goes through three main phases. The first phase is called phase 1, in which, well, actually there's a pre-phase. They actually take the vaccine and they inject it in animals. Okay, so that's called the pre-human phase. And basically they're looking to see, did the vaccine generate an immune response in the animal? And did any of them die? If it gets through that phase, then they go to the human phase. And in phase 1, they may have several hundred volunteers that they will give the vaccine to, and they're really looking for efficacy. Did it work? Did it generate the immune response? Did anybody have any severe problems? If it passes okay through that phase, and it goes to phase 2, where now they may have several hundred. So now they've expanded it. They're bringing in younger, older, different ethnic groups, looking for the same thing, safety and efficacy. And then the significant phase is what they call phase 3, where they, in this case, they brought in 44,000 individuals. And this Pfizer study was a world study. They had 9 different countries, including folks in South Africa and Brazil, where they have a lot of Black folks. So overall, they had 10% of Blacks within this study. And what they're looking for is, did it work? Did it do what it was supposed to do? And in phase 3, they call it a double blind, where a portion will actually be assigned to the vaccine, blinded, and another to placebo, blinded. Nobody knows which group they're in. Then they look and see what happened. What they found is that this vaccine was 95% effective in protecting folks from getting the disease. Once when they get that data, they present that to the FDA, which is has a group of scientists before it's approved here. They look at the data that the company had, make a determination, do they agree with Pfizer? If they do, then the FDA approves it. It then goes to the CDC, where there is another group of scientists that look at the same data and says, yes, we agree, and they may make some changes. We think it's good, but it should only be in this age group. So it goes through rigorous scientific data process before it comes out. That's how we know it's safe. You asked about hesitancy. How do we deal with folks who are hesitant? I say we deal with them with patience and love. I say that because I'm Black. I am a paranoid Black man. When 6 months ago, when we first started talking about having this vaccine, one of my patients said to me, Doc, this administration is talking about warp speed, some type of vaccine they're going to throw out there. Are you going to take it? I said, you know, from what I know right now, I'm not sure. But after being involved, looking at the science, understanding the science, I'm on panels with other colleagues of mine who are infectious disease, virologists, public health. I'm asking them questions maybe I don't understand. So we work as a team trying to get that knowledge. And after getting that knowledge, I convinced myself that this is safe. So I think a lot of hesitancy can be overcome by listening to and understanding the message from scientists and data.
So speaking of the vaccine, one of the questions was, what's the difference between the Pfizer and the Moderna? Is there, you know, should you take one and not the other, or how if you?
Good question. So Pfizer was the first one that was approved only because they were the first ones that went before the FDA and presented their data. That took place. It was approved under emergency use. The committee in California that I was on agreed that it was safe and approved it. The Moderna vaccine is close behind. The FDA committee that evaluated the Pfizer just evaluated the Moderna vaccine this week and approved it. What is the difference? They're very similar platforms. What do I mean by that? Both of them are what we call messenger RNA. This vaccine has no piece of the virus. It's totally new science and technology where they, as soon as the virus was identified in China, they can now replicate that vaccine on a computer. And then they use that knowledge to create a piece of messenger RNA, which we all have in our body, but they can produce it synthetically, that replicates a piece of the virus synthetically. And then they put it in a platform that they can put in your body. And that gets in your cells. It produces just this tiny spike of protein that's similar to the coronavirus. Your body thinks that is the coronavirus and starts producing antibodies against it. So the Moderna vaccine and the Pfizer vaccine, both of them use that platform. So there's very little difference between the two.
A couple of more, Doctor. One, I understand the initial injection takes 10 days to become effective in the body. Is it possible to become infected between the first and the second injections?
Yes, it is. When you get the first injection, it takes about 10, 12 days before you start getting an immune response. And then 3 weeks after the first injection, some estimate you may generate about 50% protection. About a week after the second injection, that's when it goes up to 95%. So yes, it is possible that when you get the first injection, that you're still vulnerable to get the infection.
Another question, knowing I have a number of medical issues / conditions, my concern is how would it affect me, knowing this is primary respiratory, COPD, asthma, high blood pressure? Have they tested people with some of these conditions, and how has it affected them?
So yes, in the study, there were individuals with multiple comorbidities, asthma, emphysema, diabetes. And what they found was that across age, across race, ethnicity, and comorbidities, everybody got the same protection, 95%. So it was very effective at protecting all subgroups.
Okay, the last question, Doctor, is how long will it be until it's available to the public and also here in our community?
Excellent question. So right now, there is a phased approach at rolling out the vaccine. In the beginning, they don't have huge amounts of doses to vaccinate everybody. So they have prioritized who they're going to give it to first. And it's been determined by the CDC in the state of California that the first ones to get it here in California are going to be your healthcare workers, especially the high-risk healthcare workers that are working in hospitals, ICUs, and emergency rooms, along with long-term care facility and staff, because they're at greater risk of getting it. So just this week, doses came in, and that population has started being vaccinated. Once when we get through that population, they will then go to phase 1A, 1B, and 1C. We're still in phase 1. And then they're going through physician clinics, healthcare workers, first responders, those at greater risk. For the individual greater population, that probably won't get started until April. So the general population probably will not be vaccinated until around April, March, April, May. That's why it's important to really stress that we may see the light at the end of the tunnel, but we're still in the tunnel. And as Black folks, we're deep in the tunnel because we are very vulnerable to this. So it's clearly important that we listen to mitigation, social distancing, staying out of large gatherings, wearing your mask, because people are dying at increased rates. The virus is really taken off in this country, and especially in California.
Well, I have the Mayor Vasquez has one last question, and this will be the last question, Doctor. What is the positivity rate in San Diego County, and how many African Americans in San Diego County have tested positive for COVID-19, if you know that information?
You know, I know the positivity rate was 8-9% last week. I'm not really sure what it is today. It's been changing. I know that African American positivity rate is one of the highest positivity rates. What I do want to stress is what most folks don't know is we're real concerned about hospital capacity and treatment capacity. The reason why we have reinstituted some of the restrictions that most of us hate and don't like is that the hospital not only are getting full, but the ICUs are getting full. And they have a criteria of when it gets less than 15%, they're going to institute these policies. And I can tell you it's less than 15%, meaning if you get sick and have to go to the hospital, and if the hospital ICU beds are full, they need to start prioritizing who gets in and who doesn't. We don't want to get to that.
Well, Dr. Rodney Hood, we appreciate your answers. We appreciate, and I know the people listening tonight are better suited knowing about how they can protect themselves against the virus. And on that note, I want to give a special thank to all of our speakers tonight, including Dr. Rodney Hood, also Dr. Leon Kelley, Council Member Monica Montgomery-Steppe, Pastor John Ringgold, Council Member Ed Spriggs, Mayor Racquel Vasquez, and Dr. Akila Weber. Thank you so much for all of y'all's participation. And we want to thank everybody for joining in with us tonight. And the last thing we ask that you do is have a Merry Christmas and a Happy New Year. And we will close out tonight with Mariah Carey, All I Want for Christmas.
John?
Yeah.
One thing. I want everybody to check out the website, Black COVID Facts, SD.org. Black COVID Facts with an S, SD.org. There's a video on there called Love Letter to Black America from Black doctors and nurses. Please check it out. Stay safe. Thank you.
Thank you, Dr. Hood. Lastly, I would like to give one last thanks to the Multicultural Health Foundation, who hosted this event as part of the Together Against COVID effort. You can learn more about their campaign and their website, as Dr. mentioned, blackcovidfactssd.org. I'm John Phillips. Thank you so much for being here tonight. And as I mentioned, we'll close out tonight with Mariah Carey and All I Want for Christmas Is You. Have a Merry Christmas and a safe, happy New Year.